WIN is an acronym for Western Carolina Medical Society Interpreter Network. Anytime a doctor, a hospital, a clinic, if they have a patient who doesn't speak English, they can call us, and we have interpreters available for on-site interpreting for 14 different languages.
I help empower the patient to take control of the appointment.
We're building the bridge between the doctors and the patients.
Hopefully, I provide transparency. The communication flow is so smooth that they don't even know I'm there.
WIN works to break down barriers to care.
My health is important. Without an interpreter, I wouldn't be aware of what the doctor is trying to explain to me. So the interpreter helps me understand exactly what the doctor is saying and helps the doctor understand what I'm saying.
Right now I'm using an interpreter because my health situation, I need to be very clear about it, and I need to explain to the doctors.
We have difficult conversations with our patients. I find that the interpreters help us make a connection with those patients and their families.
There are situations when you feel like getting emotional, but you can't. You're the voice. You're making the process clear. There is no question of confusion, misunderstanding between the doctor and the patient.
We're not allowed to cry. We have to be just the voice. We have to be professionals. And there are some days that I would love to get some tears out.
Our interpreters have very, very high language skills, and they also have high interpersonal skills.
Through WIN, we get help, we get training, we get the workshops, and they're providing this amazing thing to this community because everyone has the right to understand what's happening with their health care.
Well, if there were no interpreters in this area, that would be a big mess. A lot of confusion for the doctors and a lot of unhelped patients.
There wouldn't be health care for the deaf patient. They would misunderstand the medications that they're supposed to take. They would be under a great deal of stress prior to surgery, not knowing what was going on. It would be a nightmare.
WIN is a vital part of how we take care of patients within our community.
So it's really important to have somebody who understands the medical terminology and can express it very well to the patient who doesn't speak or understand English. Because if you can't explain the illness, you can't really care for people.